Welcome everyone, and an especially warm welcome to our speakers who have taken time out of their busy schedules to join us today. My name is Diana Sino, and I'm the VP of Marketing at Bevi. For those of you who are unfamiliar with Bevi, we provide smart water machines with still, sparkling, and flavored water without single-use bottles and cans. We understand that there are many important conversations happening in our world today, and we wanted to take some time to talk about a major theme that a lot of businesses are thinking about. We know that every business is thinking about returning to work on a different timeline due to their unique considerations. And we want to talk about specific tactics and strategies for moving forward. If you have any questions throughout the session, please put them in the Q&A section of Zoom, and we'll do our best to get to them by the end of the session. Now I'd like to introduce our speakers. Eliza Beckton is the co-founder and head of product at Bevi. She leads the design and development of new products and the continuous innovation of Bevi's offering, including hardware, software, and beverages. Amy Katulski is the Director of Hospitality, Operations, and Marketing Excellence at the Boston Consulting Group's New York office. Amy is responsible for the office operations and administration, including real estate strategy and workplace experience, facility management, marketing communications, technology, and more. Christopher Wright is the Director of Procurement, Property, and Facilities Management at PricewaterhouseCoopers. Chris has been focused on managing indirect sourcing activities and strategies, supplier relationships, and internal stakeholder relationships. Gip Johnson is the Senior Manager of Corporate Facilities at the Home Depot and oversees the company's 50-plus regional and district offices, call centers, and data centers around the country, as well as the 3 million square feet of corporate facilities in the Atlanta area. Richard Garofalo is Director of Workplace Solutions at Royal Caribbean Cruises. He oversees the operations and maintenance of the company's U.S. operations facilities and manages functions associated with the building, including food services, transportation programs, wellness programs, and business center services. And finally, Stephen Yates is the Director of Real Estate and Office Operations for Vox Media. He's a passionate corporate real estate professional who develops smart real estate strategies to meet the dynamic needs of these companies and enjoys seeing the impact that efficient, beautiful spaces can have on a workforce. Let's begin by talking about the conversations that some of you are having around how your first employees would return to the office. Gip, we understand that you'll be implementing your first phase soon. What are the things that you've had to adjust in the office to get ready?
Well, first of all, Dana, thank you and Bevi for hosting this. I've had an opportunity to be a part of a number of these return to work or reopening the workplace discussions, and each time I learn a lot that really helps with our plan. So I appreciate you having me and excited to be a part of it. In reference to kind of how we're returning employees to work, I mean, the main thing we're looking for is safety and comfort of our associates. If an associate who's been working at home for 2.5 months has been productive, and all of a sudden we bring them back to a environment that they're not safe in, it's hard for them to be really productive. So we're really been focused on the safety of the employee if and when they come back. And to kind of combat this, Home Depot has kind of developed about 4 or 5 subcommittees, internal and external, over the past 2.5 months to prepare for return to work. We've done a health and safety committee, which kind of focuses on, temperature, thermal scanning. How do we do that? A social distancing in facilities group that talks about, where people are going to stand, how graphics, what social distancing looks like when you're sitting in the workplace. A reentry committee, an amenities committee. And so with all this information, we put together a phasing plan. We're not going to just drop the green flag and return everybody back to the office at one time. That just wouldn't work. So we're going to bring the we call them required people back first. And we call them required because we feel everybody's essential. So the required associates are ones that need to be connected to the mothership to do their work, that have to be here. We're thinking that's not going to be but 200 or 300 people max. And during this time period, we're going to do a lot of testing. We're going to do a lot of pivoting with what's working, graphics, entryways, all that kind of stuff. So based on phase one, then we'll move to phase two, which will be about 10% more, and we'll pivot a little bit more, add or subtract or do some additional things. And then phase three, which will probably be 2.5 months from now, will be 25% more people. So we're going to be requiring masks. We're going to have no visitors. I mean, this is going to change and evolve every day, like this. The whole process has been happening. But the bottom line with our main campus here has 6,500 people. If we never reduce social distancing guidelines, the maximum we can get back into an office is 4,200 people. So, that's going to be a factor on how things play out over the next, 3 to 4 months, and if and when people come back. So we'll be using a lot of signage, a lot of, PPE equipment to keep our associates safe. So we're excited to see what's going to happen over the next few months, and we're going to drop the flag for phase one on Monday morning. So we'll see how that works.
It's exciting to hear. It's starting soon. Richard, you've mentioned before that you've been modeling your return to the office from other companies that have already started this. What are some of the helpful strategies from looking at other companies around you?
Well, thanks. Thanks for inviting me this morning. I really appreciate the invite. And so what we've done is we've been, had a task force together, much like Skip said at Home Depot, with comprised of a number of different work groups. Our public health group, obviously my team from facilities, human resources, and other groups where we reach out and touch those different places in the business. And we've reached out to one of the companies that we've collaborated with is AutoNation. AutoNation returned to the office on May 1st and put in a variety of the protocols. I'm sure all the panelists are looking at a similar set of protocols like Skip mentioned about screening people before they come into the office, the use of public transportation, wearing face masks, social distancing, et cetera, et cetera, et cetera. And to compensate or to add to the industry groups that we've talked with, we've also brought in a group of medical experts to help us define what those measures are to keep people safe. Again, the paramount effort here is to keep people safe and comfortable coming back to the office. We're not going to force anybody to come back. We're asking for volunteers. We're actually opening Monday with 25% of the population of one of our buildings. And then we'll subsequently add 25% in the coming weeks. And again, it's a voluntary basis. But the most, the lesson that we learned from AutoNation about after them being open for a month, the most difficult thing they're having to contend with is people keeping their mask on. So I think it's it's a protocol that we're going to all need to understand and learn how to adapt to.
Great. Eliza, you currently have people working in the Bevi lab. What has this process looked like for you?
Yeah, so we're still designing, working on new products. And so we have people in our lab actively assembling machines, design and development going on. Those are kind of our essential employees. And they're kind of leading the way on showing us how to work together and under these new guidelines that we've implemented. So things like limiting the number of employees in a space, in kitchens and conference rooms, distancing between workstations. We even have kind of outlined on the floor, taped off areas that are okay to walk into, signage that covers all of that. We give out masks to the employees and other protective equipment. And then, of course, ongoing cleaning happens quite frequently. So that's kind of what that looks like.
Do any of the other speakers want to discuss how they're navigating this situation with their landlords and what's being discussed around entry requirements into buildings?
I'll take a stab at that because we have a mix of sole tenant buildings where we're the only occupants in that building, where we can control the entry process and the exit process and the protocols to get people into the building. We also have other buildings, majority of our buildings outside the United States and some locations in the US. We're co-located with other tenants in a multi-tenant facility. And the most difficult thing that we're having to understand is how the landlords are going to control those common areas and the entry point into the building to prevent somebody from coming in that hasn't gone through a screening process, that hasn't been, weeded through to make sure that they're not going to bring contaminants into the building.
I think, and I'll add to that. It's Chris Wright from PricewaterhouseCoopers, and thanks for having me. In our discussions with landlords, we've got all co-located spaces, and the challenge we're finding with some is they can't provide the level, particularly in some of our smaller locations, they can't provide the level of cleaning we need, and so we have to go source that as an add-on. And so we're leveraging our facilities maintenance outsource provider to help us go find those solutions.
And also, I'll add to that, just we're also finding the problem with consistency. In facilities we own, we can do what we want. Touchless faucets, touchless urinals. In offices where we lease space, we have to go to the owner and say, hey, we need the same consistency we have here, because we want the associates to feel consistent when they're across the board. So we're having discussions to where do we pay for adding touchless faucets and touchless urinal or flushers to their restrooms, or are you going to do it? So just the consistency with landlords has been an issue as well.
I'll also say on the landlord topic, we're very lucky in New York. We have a really supportive landlord, and we've been in heavy communications with them. And something we've really started to think about is how can we let employees know what the building experience will be like? Because as people contemplate returning to work, our agenda has really been, from a communication standpoint, to try to be as transparent as possible. And I think you can fight some of the anxiety by just sharing what you know and trying to bring to life how things will be different, and almost walk them through virtually what that experience will be like. So if they do choose to come to the office, it is not something that's especially jarring for them. So we're grateful for advance information so that we can start to slowly unpack that with our staff.
Yeah, that for Vox, it's one of our biggest things we're focused on is how the narrative we can tell our employees and set expectations for what their entire journey is going to be from the time they get to the front of the building until the time they get up to our space. And we're in entirely multi-tenanted buildings across the portfolio, so it's a different experience in each building, which creates its own challenge. But just having transparency and communicating that to employees so that they can make their own decisions on how they interact with the space and also what to expect. It's a big part of our efforts.
Yeah, and I'd add to that as well. We're actually having to have extended discussions with our clients too, because when we're sending our staff back to serve clients at their spaces, we have to also figure out what our clients' landlords are doing. So but I think it's been said several times, safety of the staff and making sure they're comfortable is paramount. And so we're certainly not forcing anybody back until they're ready to go. And we're equipping them with some kits that we deploy virtually as they head back to those client sites.
Great. Well, thank you all for your opinion on this one. If there's no more comments, we'll move on to the next question. So as the planning process continues, I'd love to hear about how any of you are using technology in regards to a return to the office. Christopher, have you been using any software to manage how the physical space is used?
Yeah, we have. And I before we kind of go to the forward, I want to look back for just a second. We've invested heavily in tech last 2.5, 3 years. Our technology platform has been an area of heavy focus for us. And, obviously not anticipating something like this, it's certainly paid off in a longer glide path to return and allowing us to err on the side of caution. Some of the things we've equipped people with around virtual collaboration, training, certifications, the things we used to do in our spaces or at hotels for bigger groups, we're now doing at home. And that's obviously paid off in a big way in the last couple of months. So, you know, that investment was well thought of and well executed. In terms of our in-office strategy for technology, probably the biggest piece of software that I think we're going to be leveraging. PwC is 100% hoteling office, so nobody has assigned space. Even partner levels are booking space on demand as needed. So, you know, leveraging our hoteling software platform to, you know, look at our floor plans, limit, you know, close entire floors, close sections of our floors, shut off access to individual seats for booking. You know, it's going to be really helpful as we try to force some social distancing when we get back to the offices. You know, and we're adding to that some analog options as well. We've got free address seating in that solution that, you know, is open and available. Whether we'll shut that off or parts of that off is undetermined yet, but we'll do some things around moving seats around or reconfiguring some of those free address spaces as well to make sure we keep social distancing in an area of focus.
Are any other ways that any of you are using technology, such as things around contact tracing?
I could start. We are initially starting out with manual contact tracing, which we had implemented in a rudimentary form prior to us shutting our offices back in the middle of March, where it was voluntary and we were manually tracking people and notifying people that they had come in contact throughout the day. We're exploring, you know, apps today to institute, you know, more advanced contact tracing and using some of the technologies and smartphones to be able to do that. But we're not at the point yet where we're ready to introduce it. And again, you know, to respect people's privacy and HIPAA laws and PPI, we are making it voluntary. We're not going to make it mandatory. So you don't have to participate if you don't want to. But that's our plan for contact tracing.
Yeah, one of the
Great.
tools, oh, sorry. I was just going to add, one of the tools our facilities management and securities teams will also be using is access control. So, you know, we've restricted access to all of our closed offices today. And as we start to go back in phases, we'll turn on access for employees who are supposed to be there and track and report on some of those metrics to, you know, keep everybody a bit accountable too for being where they are when they're supposed to be there.
And I'll add that our, you know, the technology for space management and people management, we have a system called SaraView or Archibus we use to kind of do our space planning. Those companies have really kind of geared up to expand their platform to have, you know, social distancing guideline layouts to where you could put a 6-foot ring around the center of a floor plan, and it shows you, you know, who can sit around that area. And so our, you know, our space management and people management systems technology has really helped us with developing floor plans we can give to our leaders on each floor to kind of say, here's where you can sit, or if you bring everybody back to the floor, here are the open spaces, here are the spaces people can sit in. So it's been a great tool for us with space management.
Diana, can I just add another point?
Sure.
This sort of came in on the Q&A online as well about employees being screened, you know, in the morning when they come in, and are they allowed, you know, if they leave the building for lunch or to run an errand, do they have to be rescreened when they come back in? We're implementing a self-service screening kiosk that actually will, you know, take your temperature, and if you pass, it will print out a photo ID with the day's date stamped across the top of it and our logo on it. And once you've been screened for the day, you're allowed to enter the facility and leave the facility anytime throughout that day. We're not going to be doing multiple screenings during the same day.
That makes sense.
And we're kind of looking at it the same way. There's no way that we're going to screen or take the temperature of every associate that comes into the building. So we're at Home Depot, we're putting together PPE kits to send to our associates. And in that kit is a thermometer. And we ask that You take your temperature. If you're coming to the office, you take your temperature, personally take personal responsibility and take your temperature. If you're sick or have a temperature, don't come. So we will be taking temperatures and screening deliveries and visitors. But from an associate standpoint, we're asking them to take responsibility for their own temperature before they come to the office.
Is that going to be reported anywhere, or is that just their own personal check before they come in?
I mean, right now for us, it's just going to be your personal responsibility.
Gotcha.
Yeah, we are doing a similar thing. We're providing a welcome back kit to our employees the first day that they come back to the office that has face masks, hand sanitizing gel, and personal size hand sanitizing gel, personal size container of sanitizing wipes, and just some index cards reminding people about social distancing and wearing your mask and washing your hands, et cetera, et cetera. So the PPE thing is critically important, and again, so we're issuing those as people walk in the door for the first time.
All right. So as you continue on with this process, how much are you involving employees in the planning? Has anyone selected a task force or solicited input? Gip, I would love to hear your thoughts on this one, kind of maybe more around surveying or what other things you've done. Oh, you're on mute.
I mentioned earlier that our subcommittees are all associates. So every committee we have, health, safety, reentry, social distancing, all these committees are associates, and they're all, they all are doing what's best for the associates. Home Depot takes care of our associates better than anybody, and that's on the forefront of everything we do. But the task force are made up of all associates. We've sent out a number of surveys, a couple of surveys, and it's kind of really interesting to see what we've found out from the surveys. I mean, we've sent out, asked questions like, would you feel safe coming back? Do you need to come back? What are your reasons to come back? So, we've asked all these questions, and we've come up with some, people have really come up with some surprising answers. I mean, there's some people that just want to come back because they want to see people. They want to be around people. They want to have, they want that interaction. Two, they need a printer. They need a scanner. And we're finding out that, the primary driver to come back to the office is collaboration. That, just to meet with your project teams, to look at items, to look at products, to go through schedules. It's just, to collaborate is what we found the main reason to come back. But, it's been really interesting that, 2.5 months ago, if you would have told the Home Depot leadership team that 15,000 people in about a week and a half time could completely vacate the office and we'd still be as productive as we are, I think people would have laughed. So I think senior leadership and, the C-suite folks are finding out that, hey, when you're forced to work from home and it works, then that kind of that's a paradigm shift to kind of go, okay, what do we do with our office space? And, do we need people to come back? And, and right now our senior leadership team has said, if you don't need to come back, don't come back. So it's been real interesting, and that's going to be, that's for another discussion is, what the workplace is going to look like in 2.5 years or 3 years based on what we've learned from this pandemic. So it's really interesting that what we've learned from our surveys and of our associates.
I think PwC, one of the things, because we've been surveying our staff as well, we've also been, our senior partner and our lines of service leaders have been hosting calls bi-weekly to update and, check in. But, I think one of the things that they're learning from the survey is the bigger cities like New York, where we've got a lot of people, the push to come in isn't about so much wanting to be in the office as people that have 6 roommates in New York City who are tired of trying to work in a small apartment with 5 other people. So I think that's where we're planning for the biggest press. Otherwise, we've, listening to our people through surveys, a lot of them are very comfortable to stay away until they think, things feel a little more safe, and maybe some of the amenities that we can turn back on will push them back into the office.
So it's really interesting, get the point you mentioned around collaboration. I'd love to kind of transition to Amy and talk about how do you think about motivating employees and supporting their mental health during the ongoing transitions?
So luckily at BCG, employee mental health and wellness has always been a priority, because if it's not, it's very hard to turn on amidst a crisis. And I'll also say we are inherently a people first business. And so to be able to lean on that primary value has been incredibly helpful over this time. And so it's been a multi-tiered effort that is going to continue and beyond, again, an amplification of the work that we were already doing in this space. So it's everything from priming line managers on how to lead with compassion over this time in a virtual format, what to look for when it comes to the potential for staff members who may be in distress, and how to also drive collaboration within an ongoing virtual space, which, using virtual affiliation tools and gatherings and so on that take the place of the lunches together and the team dinners, and figuring out when to deploy that as well has been very important. At the same time, we've also opened many conversations and trainings around topics that we know our employees are facing when it comes to a big topic has been accepting uncertainty. There's something really inherently uncomfortable around the uncertainty topic, and that's something that we are all living in right now. And so what we're finding is by just having these conversations and unpacking this, it almost becomes a release for people because everyone's experience is different. But for the first time, we actually have a commonality and a great equalizer in the fact that life for everyone is very different. And so in order to have people be as comfortable as possible with their own experience, often it really is turning to leadership to share some vulnerability and share the things that they're struggling with, and to know that mental health and wellness and business can coexist together, and that employees can bring their more complete self to work if they're able to feel like they can be vulnerable. And because this will be a bit of a long game, even as we start to reopen offices, continuing to keep our foot on the gas and to really be hearing from our staff about what they need from us, and to continue to fortify that as we go along. And I think we've had an incredibly committed team that worked almost instantly, went from the 4 walls to a virtual environment. And so in order to just continue to keep as much enthusiasm as possible, because it can be fatiguing, as we know, for all of us who are on end-to-end Zoom calls. So something else that we've really been mindful of is to be able to build in some protected time for team members. So even if team members may not feel like, can I have a lunch hour, because lunch is suddenly the cornerstone of my day, enlightening line managers of how important it is to have some blackout times with their teams, because we know how highly committed everybody is. Nothing has changed at all. In fact, the commitment to serve and support both our clients and one another has probably increased, given the fact that we want people to feel as supported as possible. So just understanding that the workday has changed, that for many people, they are either living with the 6 roommates or with their family and not without childcare, and suddenly this is all in play. Again, thankfully at BCG, this has sort of always been the total employee value proposition, but just being really in tune to the things that have changed and keeping mental health at the top of our agenda throughout.
It's really great that you're thinking about your employees so holistically. And I've definitely heard the phrase gaining in popularity around the concept of Zoom fatigue, that, towards the beginning, it was an easier transition, but people are definitely starting to get a little bit more tired of the constant Zoom calls.
Amy, I liked what Amy said about the humanizing element of it on those biweekly calls that I mentioned. even our most senior leaders are sharing, war stories of being at home with 6 kids, and, they're humanizing the experience for them as well. And I think it's important. It makes, I know I have a feeling that it makes me feel more connected to them, makes me feel like, I'm not alone in this thing, and that they're just regular people like we are trying to figure this all out. So when they humanize their experience and try to find like experiences amongst the group, I think it really has a lot of impact.
Definitely.
Yeah.
Eliza, how are you thinking about employee wellness moving forward?
Yeah, so we really try to kind of listen to the employees and our coworkers, and not just stop there, but also listen to customers. And what we've been hearing is kind of like requests for 2 sort of innovations. One being in the beverage space. Before COVID hit, we had put out a pomegranate blueberry with electrolytes flavor, and that was incredibly popular. And as things have been progressing, there's been more requests for functional ingredients like vitamin C's, ginseng. And so we're actively kind of researching and developing things like that. And then sort of the second area of requests that we hear a lot from customers is for a touchless solution for Bevi. And I know there were a lot of questions in the Q&A on that. So that is something we are actively working on as well. We're committed to putting out a solution, and actually on June 12th, we're going to release more specifics around that. So timing, features, functionality, things like that. So that'll come really soon.
I would add too on the wellness and well-being side for us, of course, our workforce and our employees, we've always prioritized their wellness and well-being. But we, like most of the panelists and people on the call, we rely on a bunch of service providers to help make the workplace experience what it is in our offices. And so we've started to reach out to some of those providers now to make sure that as we think about returning to the office, we're going to need a support ecosystem of different providers. And we want to understand how those employers treat their employees and what the expectations are for them during this time and commuting to the offices and things like that. So we've it's been interesting to sort of expand how we think about those service providers and key partners who we've always counted on to be aligned with our values, but even going further to understand how they're treating their employees as it relates to going back into the office.
So
I'd
just like to add one point, if I could, Amy. So we've continued our wellness programs online through WebExes and Facebook and other social media sites. We've been running classes, meditation classes, yoga classes for people that are working remotely. Obviously, our gyms are not open, but again, we've tried to maintain as much of the wellness program as we could while people are working remotely. And again, we will continue to, promote that either remotely or in person when we do return to the office.
Amy, were you about to say something?
Yes, just actually to build on what Richard just said, there was a question in the chat about what tools you can actually use to replace in-person affiliation. And there are many low-cost, high-impact ways to go about this. And Zoom is actually a really helpful product for this. So we've done like Zoom trivia, name that tune, and it gets very intense and very fun. You can do a virtual lunch date with your team where everybody brings their lunch and talks about a topic. We also, the meditation that Richard mentioned and yoga, don't discount the talent you may have on your teams already, offering them to offer a master class in maybe it's photography or pizza making or something like that. And so there's a spectrum of just sort of really joyful affiliation and then true mental health activities like mindfulness, coaching and meditation and so on and so forth. And I'd say again, there is likely a lot of talent within your team. So if you are in a company that may have spent less time on this, spinning up a committee that can look into this and maybe drive it for you is something that's really helpful. Also ensuring that you're meeting people where they're at in terms of their interests.
Okay.
Please get those touchless water dispensers out there as soon as you can. That's a big issue for us. I mean, we're bringing pallets in of bottled water to distribute to people because we're not allowing them to use the water fountains or the ice and water machines initially in phase 1.
It's coming soon.
Stay tuned. Great. So since some of you will be phasing employees into the office slowly, I know we touched on briefly before about how some of those decisions are being made in terms of who gets to come in first. Does anyone else have any comments on that in terms of, you know, how much of it is based on volunteering versus role and need?
Yeah, I'll start.
Oh, go ahead, Chris.
For us, we have about 5% of the workforce who relies on some of the specialized equipment we have in our offices. We build production facilities and infrastructure, and so it's easy to categorize that group as being really office reliant and prioritizing getting them back in the office. But similar to what we heard earlier on the surveys, what we heard is that most people come in because they like it and they like the routine, they like the social aspect and those things. And so, and within that group, you have people who are comfortable coming back now and people who are very uncomfortable. And so, we're going to set a really high threshold and push people on, do you actually need to be in the office or is this just a convenience for you early on? Because the reality is we've continued to work remotely and we feel productive. And so it's hard to justify exposing somebody to extra risk just for a convenience now. Anyways, I think down the road, that would be something we'd get a little more comfortable with, I think. But for now, we really have a high threshold and we'll be pushing on minimizing the number of people we send back in.
Richard, I think you had mentioned a volunteer list before.
Yeah, we started out with just people who wanted to volunteer to come back. And one of our guiding principles is that we're not going to force anybody to come back that is not comfortable coming back. However, what we're starting to experience, excuse me, is a little bit of peer pressure being exhibited by the people who are volunteering to come back and the people who are opting to stay home feeling pressured to kind of make a decision to come back. Maybe not in the first wave, but in the second wave or in the third. But again, we're respectful of people's decision and we're not going to force
Great. I'd like to shift the conversation a little bit towards building relationships among employees. So, we've touched on this before that, and we've seen a lot of survey data around that. One of the main reasons that people are eager to come back is to interact with their coworkers. Stephen, could you share some thoughts around, over the next year, how can people be making efforts to continue to build relationships regardless of where their office is in the process of returning to work?
Yeah, we've historically had about 30% of our workforce remote. And so we're used to using some of these tools, whether it's Zoom or Slack, to collaborate and to have those interactions. So we'll, of course, be leaning into those. But we're also thinking about how do we, as we think about having more people remote in the future, how do we support those people in different ways? How do we, what's our approach to parents who are now going to be working from home? How do we continue to improve on career development for people who aren't necessarily coming into the offices? And then, once we have our offices more open back up in a sort of more normal or something we're more used to, trying to understand how do the offices function now? Do they, we've been had 100% assigned seating plans in the past, and so people would come in and do their work at their desk and use the conference room, go to the cafeteria and have that sort of a routine. Maybe that's going to change for us a little bit and think about the offices as being more of a gathering place to do the brainstorming and socializing. And then some of the more heads down work happening at home. So for us, it's a blend of rethinking how we interact with the workplace, but also how do we support the remote work to make it feel like one experience.
I know it's probably pretty early in the process to be thinking about this, but as you think about making the office a very collaborative space for people to come together, have there been any thoughts that have crossed your minds of potential options or things you might do with the physical space to continue to support that? You mentioned before assigned seating, and maybe that would change. Are there other things that have been top of mind for you?
For us, it means, it would mean less desks and more collaboration space. We run pretty dense open offices, and so thinking about how we can change from everybody having their own desk to, replacing a pod of 10 desks with some sort of an open air brainstorming area, and also more conference rooms too. So it's a shift away from those dedicated desks to more collaborative spaces.
And I'll jump in and say that, we're looking at it right now, pre-vaccine and post-vaccine. We're not going to make any dramatic changes yet to, large capital investments to redo workspace until we, I think we have time to kind of see what the next 4 to 5 to 6 months will hold. I agree with Stephen wholeheartedly. I think that as people learn that they can work from home, and if they want to come into the office to collaborate, instead of building more offices, maybe we build a floor out as a, collaborative type of seating area that has different type of work environments, high tables, low tables, round tables, stadium seating, just some creative ways for people to come in and meet, and then they can pack up and go back home. So I think that's definitely, what we're learning from a collaborative standpoint is that, we're being pretty productive from home. What does it look like? But as I said, I think it's, I just don't know, the term new normal always kind of eats me up. And I look at it from the standpoint of, once the vaccine is found, do we go back to normal? Is it going to be the same? Or do we take what we've learned and apply it to save space, not need as much space? So it's going to be interesting. There's going to be a lot to learn over the next six to 8 months.
I think the other thing I would add, and it's an interesting wrinkle, but an extension of the real estate strategy, is around those co-working type solutions, right? Like as we think about our portfolios maybe needing to shrink, and so that means less space for that type of collaboration, right? It becomes harder to justify that CapEx for that type of space. The Convenes of the world as one company, as an example. Obviously, there's lots of others too, but that, I think those are going to start to become more of an extension of our real estate portfolio and baked more into the strategy than they might be today.
Sorry, I didn't mean to interrupt.
I'm sorry, Diana. One of the things that we're looking towards is the guidelines that are being issued by, a large percentage of our employee base is in Miami-Dade County. And Miami-Dade County has a direct set of directives out there about returning to normal, and one of the restrictions is you can't have more than 10 people in a room. So we're under that constraint, and until that constraint removes, we can't go into these large collaborative spaces like some of the other folks are talking about on the call.
So kind of on a somewhat related note, that we were talking about things that people have learned during the work from home period. Are there any of things that have worked really well or that you've learned that you could imagine in the future bringing into the office space?
Well, I'll say that I've been really surprised and pleased with how well some of our virtual events have been going. Specifically, for our alumni, we have a very meaningful commitment to BCG alumni. And given the fact that our office is in Hudson Yards, we are not easily accessible. We're not in Midtown Manhattan. And so we have an amazing office, and we really hung our hat in bringing people to us and hosting topic experts and panels, etc. And sometimes we have been hampered by the fact that at 5 o'clock, someone doesn't want to get into a cab or an Uber to go to Hudson Yards necessarily if the weather's inclement or so on. And so we have been trialing many of these same type of events that we would have in the office, and we had it virtually, and we have found that it allows more people to become engaged because they don't have the challenge of having to commute even within the city. And so that's something that I hope we continue to carry forward with this is, when we really want to reach the maximum amount of people, not necessarily replacing every event with a virtual event, but how can we continue to allow people to opt in virtually, and what type of virtual formats like this one actually lend themselves quite well to these types of conversations.
Yeah, I think just to add to what Amy said, the video conferencing, capabilities that we have today have, increased our productivity because people are working earlier in the morning, later in the day. They're not taking, long breaks for lunch. There's a whole different dynamic associated with being able to work anywhere, anytime that has increased the productivity to the point of where people are, logging off at 6 o'clock and walking away so they stop working. But I think that's here to stay.
Great, thank you everyone. I think we've got about 10 minutes left, so I'd love to move to some questions from the audience. So one of the first questions that came through is people would like to hear from the panel on what they've done to restart maintenance on some of their buildings. Is there any advice or experience that you'd be willing to share, maybe Richard or Gip on that one?
Yeah, I'll kick. I mean, we've continued our normal run rate. We've been able to instead of having the janitorial staff clean the buildings at night when nobody's in, we've repurposed them to start doing painting. We've done pressure washing. We've done instead of doing the annual carpet cleaning of our buildings, we've done that just through a regular run rate. So we've kind of tried to repurpose most of our team to keep them employed. We've done. I told somebody this morning as I walked in, our buildings look better. I hope nobody comes back because our buildings look as clean and fresh and painted as they've ever looked, because we've been able to do so many projects that you just can't do while people are in the building. So. And the other question I saw that came through, Diana, was in reference to HVAC and what you're doing with the HVAC, because I know that's a big question in reference to recirculating the air. And, most HVAC systems, unless you use a huge capital expense to, redo the systems to accept HEPA filters, the main thing we need to do is just make sure you're recirculating that air. We recirculate our air every 20 minutes on our floors. I think we've increased our filter changing. Instead of quarterly, now we're doing them monthly. But unless you want to incur a large capital expense to change it to HEPA filters, which, we don't even know if that works to fight the virus. We're just making sure that we've got with our engineers to make sure that the system is recirculating air correctly. We've increased our filter changes. Because I said people talk about the virus is in the air and how do we get rid of it. So that's what we've been doing kind of from a maintenance standpoint.
Yeah, I just like to add to what Kip said that we suspended our janitorial services and most of our maintenance services while we were closed. The only service that we kept going was our pest control service. And when we put a plan together to reopen the offices, we reintroduced our janitorial staff and some of our maintenance functions to go and do some of the things that we need to do to prepare to reopen. And we've also re-engaged our our HVAC contractors, like Gip said about, changing the filters on a monthly basis instead of a quarterly basis, and using the highest, filtration elements that we can use with the system, constraints that we have. And to his point, in order to put HEPA filters in, and there's no guarantee that a HEPA filter is going to work, you have to re-engineer the entire system. And that's a huge capital expense that I don't think any of us are willing to bear at this point in time. And the evidence that we've seen from the CDC and from the National Institutes of Health and from ASHRAE is that it's highly unlikely that the virus is going to survive being transmitted through an air conditioning system. You're more likely to pick it up from talking to somebody that doesn't have a face mask on.
So on a very similar note to that, a question came through about how are you maintaining high traffic areas to, reduce transmission there, for example, areas like kiosks?
Mask.
Yeah, the only thing I'll add to that, just to contemplate as companies consider their density opportunities against what local guidelines may be, which is to think about sort of those tightest choke points. So whether it's bathrooms or whether it's hallways, so you can do the math, right, and start counting 6 feet apart and figure out how many people you can have at any given time. But there are those points that naturally where people are going to be running into each other, elevators, etc. So to always calibrate sort of that 6 feet apart math with the natural places where people are going to need to run into each other, and consider in those, especially in those early phases, how that would be addressed and how that acts as an overlay to just the number of people that your office can support.
Another area where, and this is certainly not in all of our buildings, but some of the ones that have smart elevators, we're reprogramming those to reduce the number of people that it'll let on one elevator bank, or one elevator cart. So, typically our smart system would let those get pretty full, but now it'll send you to a line to wait for another one versus jamming you in. So that's another way we're using technology.
Deanna, I'll add the same thing as Richard and Amy is, you can't put queuing buttons all over your building and have it perfect. Eventually we put in our elevator lobbies where we have choke points, big A-frame signs that says mask required in this area. And, you have to be responsible for yourself, because if you have to be told where to stand on a button, then you might not need to be in the office. Take personal responsibility for yourself and your associates. So, I was telling our team the other day, I was saying, God, we're going to have so many signs around this building, but I think the more the merrier, and then we'll kind of back down from there.
Yeah, I think same thing for us on the high traffic areas. It's sort of twofold. Provide the signage so that people know what's going on and can make their own decisions, but also just reduce the traffic. And for us, that means having fewer people in the office for a while.
And yeah, a lot of this is really common sense, okay? We've been educated and pounded into our heads for the last 3 months, wear a mask, stay 6 feet away from somebody, wash your hands, don't touch your face. We're not transporting people to a different planet to come back to work. It's still going to be it's just going to a different building other than going to the supermarket or to the hardware store or to the Home Depot, right? It's the same protocols, avoid people, avoid touching people.
Definitely. Makes a lot of sense. So some of you talked about before about the different PPE packs that are being given to employees. And one of the questions that came in was whether these are being issued to employees before entering the office or if they'll receive them upon coming to the office.
I can cover that one because we're doing both. So the ones we're preparing some to be ready for people when they come to the office, but we're using a portal ordering system for people who are going to order them to go to client sites. And since we don't want to assume that they're at home versus staying somewhere else, the portal, they'll tell the portal where they want that shipped, and so they'll have it in advance of that trip to the client site.
We're providing them to the employees when they return, when they return to the office for the first time.
How are each of you handling corporate travel for your teams?
We banned all corporate travel.
Same.
We do have our jets that fly the LT team around as needed, but there's no corporate travel at Home Depot right now.
Same here. No corporate travel.
Yeah, we also have no travel, and it's been interesting what we've heard on some of our in the studios business who is mostly in Los Angeles. They've been making pitches remotely where they would typically travel or be at a client site, and they've actually been very productive. So it's been good learning experience for them.
And another question, I think we talked about this a little bit before, but it came up in the Q&A, but there was a specific question around how to encourage employee engagement and create a positive employee experience moving forward.
I think Amy may have mentioned it, and I would say one thing we've learned the hard way on our teams is it's one thing to say we're going to have a virtual Zoom happy hour, but being on a happy hour with people you've been on Zoom meetings all day with and not having any sort of theme or plan gets awkward fast. So I think we've, like Amy, have started to do some things like trivia or a theme or even breakouts on the happy hours based on interest. Because I think just putting people in a virtual happy hour can actually have the opposite effect that's intended. So putting some thought behind those things, I think is well worth the effort.
Yeah, and Chris, as I said earlier, I said if you're having people come back to the office and you're not giving them the comforts that they need to perform and to work, open amenities, open gym, open Starbucks, then I mean, why are you opening? So, I think that's slowly going to happen, but I mean, I think you've got to give tenants, associates, amenities they need to want to come back and to make the workplace, as much as you say fun again.
And I also think, especially in the early phases, it's really asking your staff, how are you doing? How did we do? Especially those folks who are coming in initially. There's no roadmap for this. We're going to be testing a lot of things. So especially when it comes to wayfinding, to signage, to as much of the experience we can offer, to the communications, being able to cherry pick people from within the community and just really getting their direct feedback as you would when you were opening, for those of us who have opened offices in our regular day job, to help us adjust and pivot our strategy. I think making time for that as well, to sort of sanity check some of the things that you think really work on paper is critically important in the beginning and beyond.
Eliza, we're getting a bunch of questions on how to sanitize the Bevi machine. Would you want to speak to that one? I'm also happy to take it.
Sure. Yeah, so basically don't spray it directly with any kind of cleaning fluid. Just use sort of like an antibacterial spray, alcohol-based, on a wipe, and then use that to wipe it down.
Great, and I want to be respectful of everyone's time. It's 1 o'clock now, so we'll wrap up here. Thank you everyone so much for participating in today's session.
Thanks everyone.
Have a great afternoon.
Thank you.
Thanks a lot.
Stay
Thanks.
safe.
Bye-bye. Stay safe.